Hi, this is Dr. Ken Starr with the Wellness Group in Arroyo Grande, California. We're NAD experts and passionate about substance abuse recovery. I wanted to take just a couple of minutes to explain about NAD. Some recent press has come out about NAD that hasn't been real favorable, and really it highlighted a story of someone who didn't know what they were doing and just used NAD in an inappropriate patient. What you need to know about NAD is that it's a tool. So if you're using NAD just for wellness and you want to see if it'll make you feel better and clear the cobwebs and cognitive decline and migraine headaches and anxiety and some general things like that, you certainly can go to a regular infusion clinic and try some NAD. Try to make sure they know what they're doing. But if you're using NAD for a substance abuse indication like detox, post-acute withdrawal, make sure you're going to a standalone treatment center that just knows what they're doing without NAD. Okay, NAD is a tool we can add to standard treatment. It's not, treatment. So in and of itself. So in other words, if I have a sick person who's detoxing off alcohol, they need standard of care medical treatment, and we can give NAD. But you can't take someone with life-threatening withdrawal, just give them NAD and cross your fingers. So that's not an appropriate, safe environment, okay? So if you're looking to do NAD for a substance abuse indication, make sure you go into a place that's very good at substance abuse, even without NAD, and they're using NAD as a tool, okay? Now it's true when we're doing NAD detox, NAD does the heavy lifting. It significantly alleviates withdrawal, but it doesn't eliminate it. Your brain has to heal, it has to detox and recover. There's no way around that, no matter what system you're using. So we're big believers in NAD. It changes lives, it's amazing, but make sure you're kind of going to someone who knows what they're doing. And the reason I'm making this video is a lot of people now are doing NAD. I get calls and emails from chiropractors, naturopaths who want to implement NAD in their program. I think that's great. They have a little bit of guidance on safety and on dosing, and it's a simple, process. But if you're going to them with a complex medical problem or substance use indication, I would go elsewhere. Make sure you're going to a place that specializes in that. So that's all for now. Leave your comments below. We'll try to answer them. Please subscribe to our channel, get the word out, and check out our other videos. Thanks.